Salams and welcome. Today, a very important topic: save a life with cardiopulmonary resuscitation. C stands for cardio, P stands for pulmonary. Resuscitation means to revive the person. You can either call it the CPR or also colloquially known as the kiss of life. And if you just know these basic techniques, you can perhaps save someone's life one day, your family, your friends, or even as a bystander, maybe on holiday and someone needs help, maybe on the plane. But at least if you know the basics, then at least you can try and help a human being until help arrives. Okay, it's important to know the basics because when someone collapses, we all panic. We say, what's going to happen? Let's look for a doctor, let's do something. And meanwhile, time is going. It's very important. I'm just looking for another poster here. So cardiopulmonary resuscitation is when a person's heart stops and the breathing stops. You have only about 2 minutes, 2 to 3 minutes. That's known as the golden 2 minutes. So just remember 2 minutes, although you can go up to 5 minutes to try and resuscitate a person depending on the condition. But try and see that within 2 minutes, you need to start pumping the heart, you need to start pumping the chest, you need to start getting air in. Because the main thing about a person who is unconscious or who is not unconscious but who has stopped breathing and whose heart is stopped, the main thing is the brain. The brain needs oxygen. The brain is very hungry for 3 things. The brain needs oxygen. It is very hungry for oxygen. The brain is very hungry for sugar. It needs glucose. And the brain is very hungry for water. 85% of the brain is made up of water. So sometimes when you get a headache, what do? We run for tablets. We take 2 tablets to sort our headache out. But you know why we get a headache? In 80% of the cases, the reason why you're getting a headache is because you are dehydrated. You haven't had water. So when we drink tablets, we think, oh, I feel better now because the tablet has taken my headache away. No, you don't feel better because of the tablets. You feel better because you drank the water with the tablets. The water is making you feel better. Because the tablets will only take 30 to 45 minutes to start working. But many times when we drink the tablet, we start feeling better already because it's the water. So remember, the brain is very powerful. So you only got basically 2 minutes to get that heart going again. So CPR stands for, I will keep it very simple. Please, I would encourage everyone to go for CPR training lessons, especially if you've got a swimming pool at home or if you've got elderly people at home. Go for for CPR lessons. Many places offer them. Many places also offer it for free. You got to practice it yourself. You can't just watch a movie knowing it. This also, I'm just giving you advice, but you got to press on that mannequin. You got to practice. You got to know the technique. The main thing what you'll see in movies is not right. Many movies get the CPR wrong because the main thing about CPR, you cannot bend your elbows to press on the chest. When you're doing CPR, your hands will be straight. But I'll come to that point. Let me just get to the basics. Simple basics. Back to basics. That's my philosophy. Right. Just remember A, B, C, D. Okay. A. So if you know your alphabet, then you know how to resuscitate a human being. A, B, C, D. Most places where you will see they talk about A, B, C. Okay, ABC, airways, breathing, and circulation. OH stands for, I apologize, I've got a bit of a flu and winter now. OH stands for airways, breathing, and chest compressions. And some countries and some medical health organizations, they in certain situations, the chest compressions are more important than getting the airway going. So in that case, they change this ratio around and they call it, instead of ABC, they call it CAB. So think of a taxi cab. CAB is a cab. So you start with chest compressions first, then you worry about the airways and the breathing. All right, but whichever way it is, just think of the formula A, B, C, D, and I'll go through it very quickly. So A stands for the airway. So as soon as someone is collapsed, first thing you do is you check the airway. Check the mouth, because in majority of cases, it's your child, if you're a grandparent and you see the person not breathing, just put your finger inside. Maybe there's something stuck in the throat. Try and put it slowly on the side of the mouth. Don't push the object further down in. On the side of the mouth, try and look for maybe there's a small sweet or a peanut, take it out. If a person, you just drag that person out of the river, maybe there's grass, or maybe there's a flower, maybe there's a weed, there's something in the mouth. So the first thing you do, you check the mouth, you check the airway, that is there something blocking the pipe. Then it's very easy. If you can take that blockage out, then a person is fine. You don't then have to do the compression and all of this. So the first important thing, it's very simple, and don't panic. The main thing is don't panic. Okay, you got 2 minutes. You got that golden 2 minutes. So remember that golden 2 minutes. So in that 2 minutes, you don't panic, because for 2 minutes, the brain is fine. For 2 minutes, the brain, but after 3 minutes, you're looking for trouble, because then you're getting brain damage. So for the 2 minutes, you don't panic. First thing you do, put the patient down. Always lift the chin up, put your finger inside. Don't shove your finger in. Others, if there's something there, you're going to push it further down. Always go on the side, that side of the mouth, go slowly and make your finger into a hook and you pull it. I've taken out in some patients, even my own daughter when she was young, I just was newly qualified. She had a sweet in her mouth. She was 1 minute she was playing, the next minute her whole face color started changing. And I quickly, slowly put my finger in on the side and I found the sweet. As I pulled it out, she was fine again, she could breathe again. So first thing, airways. So A stands for airways, check the mouth, that's the first thing. But it could be a tooth, elderly person, maybe the tooth fell in and stuck there. So very slowly, put your finger into hook, take the thing out. Breathing, check to see if the person is breathing. Listen, put your ear next to the face, put your hand there, next to the, can you hear the breathing? If you can't hear breathing, then you know you got a problem. C, check for circulation. And D, don't delay. Don't delay. Circulation, many times they show you must check the pulse in the wrist and the pulse in the neck. Don't listen to movies. You know, we see in the movies, the police officer or someone is just going to check here and say, no, he's dead. Please, it's not so easy. As a doctor, I can tell you sometimes it's very difficult to find a pulse. Especially if you have children, you know, they got the puppy fat. You can't feel the pulse. In the elderly patient, it's difficult to feel the pulse. So if you can't feel the pulse, just wait for the ambulance people to get there. Your job, if you see the person and is not breathing, so you're seeing the chest is not moving, you're seeing there's no breaths coming in, then you don't delay. Don't worry too much about finding the pulse. Okay, you start the compressions. Basically, what does that mean? It means mouth to mouth. Okay, this is airway. So first you've checked. You put the jaw upwards. You've checked already that there's nothing in the mouth. So once you've checked there's nothing in the mouth, this way here it's mouth to mouth. That's why it's called the kiss of mouth. Today, because of the COVID and because of to prevent infection, many ambulance personnel and many people carry a mask. It's a special CPR mask. But if you don't have a CPR mask, to save another human being, you have to do lip-to-lip CPR. In adults, you do it your lip to the lip. For babies, you must cover the mouth and the nose of the baby because babies are small. So if you want to resuscitate a baby, you got to cover both the nose and the mouth. Right? So the first is you check the airway. Secondly, you've checked the breathing. You saw the chest is not moving. Thirdly, you try to see if there's a pulse. If you can't finish, you start the compression. The recommended compression rate, please remember this. You must try and do the compressions on the chest 30 times. You stop and then you do 2 breaths. 30 compressions, 2 breaths. 30 compressions, 2 breaths. You start pushing the chest at least 100 times a minute. So not one, don't do too slow and don't do too fast because then you're affecting the circulation. If you're going to do it too slow, 1, 2, 3, the patient is going to get brain damage. If you do it too fast, once again you're losing out. The right way is to get at least to 100 beats a minute. 1, 2, 3, 4, 5. And the way to do it, you got to put the base of your hand, this part of your hand is hard. So you put this part of your hand here, you put your right hand over this part here, whichever one you feel, but this part here must go onto the chest. The place between your neck and your belly button is soft. As you put your finger up to the belly button, your rib cage, you get to the bottom of the rib cage where the bones are. Put it, measure about 2 fingers like this, and then put it like in the middle of the chest. Don't put it too low down because low down is called a xiphoid process. That can break, that can fracture. Right, so you put it give a space like this. Space like this from the bottom where the V of your rib cage is. Put the base of your palm, that's a hard part, and you put your hand like this. You got to put your hand like this, and then remember, your elbows mustn't be bent. That's not how to do CPR. Your elbows must be straight. Must be straight like this. I don't know if you can see it. You must be straight like this, right? Like this, straight. Must be straight. Must make it straight here. And the pressure, you start pushing from your shoulders. Your whole body must go like this, like this, like this, like this, like this. But you do it fast. 1, 2, 3, 4. So the pressure must come from your shoulders, from your back, not from your. You mustn't do it like this. 1, 2, 3. If you do it like this, that's not the way to do it. Because from here, from your pressure from your shoulders, you need to move the chest at least 5 centimeters. That means at least the size of your finger, 5 centimeters down. The most important thing you need to do in a CPR, the quality compressions. Quality means you can't do it too shallow, can't do it, no. It's got to be hard, Even if 1 or 2 ribs break, it's fine. It's better to have a broken rib than a dead person. Broken rib, you can fix it up. You can't fix up a dead person. So don't delay. And that's how I'm trying to finish. Don't delay. Airways, breathing, compressions, 100 a minute. Make sure it's quality compressions. Meanwhile, someone else is trying to phone someone. You compress for 30, 1, 2, 3, 4, 30, blow 2 times. 30, 1, 2, keep on going. That way there, the blood is going to the brain. You're keeping the brain alive. So you don't worry about anything else. Your job, even if it takes you 40 minutes, you keep it. You're going to get tired. Get someone else. Get tired. Get someone else. Get tired. Get someone else. And then if you've got someone to help you, then you reduce the ratio to 15 and 2. That means you do 15, 1, 2, 3, 4, 15, and you tell that person, right, blow 2 times. They blow 2. Then you do again 15, then you blow 2 times, then blow 2 times. So in this way, you keep the loop going until the help arrives. For children, for infants, you don't do 2 hands hard like this. You can do it with one hand, depending on the age of the child, you do it 1 hand, compress hard. But you must also try and do it not 2 inches, not 5 centimeters, do it about 3 to 4 centimeters, right? But with children, you can do it with 1 hand, like this, but do it forceful. You must see the chest moving, just do chest moving. And for babies are very gentle. Under 1 year or under 2 years, you only use 2 fingers. Here's the chest. So for the babies, once again, you find where the ribs are, above the ribs on the chest. For the babies, you use 2 fingers and you press softly. Soft. And meanwhile, what you do? We pray Darood. Pray to God most merciful. You press. Don't panic. So in summary, today's lesson, please save a life. Learn the basics. Save a life. CPR, kiss of life. Airway, breathing, circulation, don't delay. C also stands for chest compressions. Blow mouth to mouth in adults, mouth to mouth. In children, you cover the mouth and the nose. And ambulance personnel and firefighters also do that for animals, like for dogs and cats. They will breathe through the nose instead of that. And then the main thing is you don't delay, and you've got the golden 2 minutes. Don't panic. It's your grandchild or someone you care about, or someone, even if it's a stranger, try and help out. Someone collapses, don't just stand and look. You can at least loosen everything that's tight. Loosen the tie, loosen the belt, lift the legs up so the circulation goes downwards. It must do everything to help the brain. This is the most powerful organ in the universe. It is a sacred gift from the God, from this Creator Supreme, from God most merciful, has given us this gift. You got 2 minutes. 2 minutes to get that person going again. Whether it's drowning or collapsing or whatever it is, get it going. Please see the next video. I'm going to talk specifically about drowning. Stay well, look after yourself. Let's try and save a life. And please share this with other people. Let's share knowledge so other people can benefit. Maybe someone can benefit from this, and someone, somewhere, can do a CPR, and somewhere in the world, because of this, we can help a life. What a fabulous gift. Stay well, look after yourself.